Lawmakers returned to committee this week for a heated debate over a proposed bill restricting gender-related medical procedures for minors. Conservative commentator Matt Walsh was called to testify, sparking tense exchanges with several representatives. The hearing began with a legislator asking Walsh to address claims circulating in the media that opposing the bill was pro-life and that gender-affirming care prevents suicide.
And who would this be directed to? Would you like to come up?
If I could ask Mr. Walsh.
Okay. Mr. Walsh, if you would mind.
Matt, thank you for being here.
You're recognized.
Just a quick question for you. We've heard in the news last week and even today that it's pro-life to vote against this bill. We've heard that suicides are prevalent, and suicide has impacted my family, so I'm sensitive when I hear something like that. I've read some of the stuff that you've done, and I was wondering, can you speak to the statistics of mental health and suicidal tendencies for the people who have gone through transition and for people who have not? In your studies, from what I've read, can you speak to that?
Mr. Walsh, you're recognized.
Sure. Well, the claim that doing the chemical castration drugs or surgery or hormonal intervention, the claim that this prevents suicide or has positive psychological effects down the line is utterly, totally baseless. There are no credible long-term studies that bear that out. And one of the reasons for that is that there couldn't possibly be any credible long-term studies because we've never done this to kids on this scale ever before in history. So this current, shall we say, crop of children, they are the guinea pigs. This is all experimental. We're sort of trying it out on them to see if it works. Now, they have attempted a few times to do studies, and the interesting thing is that the World Professional Association of Transgender Health, WPATH, which is a radical far-left pro-trans organization, they commissioned a study to try to prove that that hormones and puberty blockers decrease suicide rates among trans-identified youth. And even in their own study, they found that they couldn't prove it. They couldn't make that link because it's just not possible to do. The other thing I would mention too is that, the number of trans-identified youth has skyrocketed in recent years. We're talking about exponential 10x, 20x growth. Just huge numbers have increased. And what we hear from the pro-trans side is that, well, this is not a social contagion. It's just that, there's always been this many trans people. It's just that they were not in an affirming environment before in history, and so they couldn't come out. And now, for the first time, trans people have the ability to live their truth, so to speak. Well, if that's the case, and there have always been these sort of like millions of trans people, and if it's also true that if we don't affirm them, that it would cause them to commit suicide, then we should be able to look back in history and find just this unbroken, incredible epidemic of children mysteriously killing themselves because they weren't being affirmed as trans. And what you find is that that didn't exist. I mean, the youth suicide rate has increased exponentially alongside trans affirmation. So trans affirmation causes the suicide rate, not the other way around. The last thing I'll note is that the suicide rate among trans-identified people is sky high. It remains sky high. All the data shows this. It remains sky high even after surgery. And in fact, in the most reliable data that we have, it's years after surgery when suicidality is the highest for trans-identified people. That's the reality.
Chairman Preston, you good? Okay. Any further questions for Mr. Walsh while we're out of session? Mr. Hammer, Representative Hammer.
Thank you. I found it, thank you, Mr. Walsh. I found it interesting. One of our people testified today that they had their gender affirming surgery at 16. And I know you in former comments mentioned this on your blog. At about 16, you're an adult who's mature and can make decisions. You're that at 16. I don't care what anybody says. Even going so far as to say, 16 people when you're 16, you should be married and could be pregnant or should be pregnant. So I'm curious if 16 is an adult in your view. Why does this bill have the minor defined as 18?
Mr. Walsh, you're recognized.
Yeah, that's a hit piece you took from Media Matters, from something when I was a radio host 13, 14 years ago, in my early 20s. It's also not an accurate reflection of what I actually said. I was talking about the fact that people tended to marry young historically And that's all that was about. How does that relate to this subject?
Just curious of your definition of if you feel like people are adults at 16 should.
Well, people are
should
adults at 18, but actually, your brain is not fully developed until you're 25. So we should be having a conversation about whether we should even be doing these surgeries to people at 18. But certainly before 18, it's absurd. I mean, do you think that a 16-year-old can meaningfully consent to having their body parts removed? Do you? No?
We do not. Yeah, we ask the questions. It's not you. It's Representative Hammer. You are recognized. No more questions. Okay. Representative Clemens, you are recognized.
Yeah, thank you, Mr. Chairman. Can you give us a summary of your educational background or your healthcare education experience?
Mr. Walsh, you are recognized.
My experience in healthcare?
Your educational background. I'm just curious. You've testified as to a lot of your own research. So I'm curious for what purpose you do that and what background you have to qualify you to speak to that.
Well, my
Mr.
background
Walsh.
that qualifies me to speak to this is that I'm a human being with a brain and common sense, and I have a soul. And so, therefore, I think it's a really bad idea to chemically castrate children. That is my experience. Also, I did. Now, it's true. I didn't go to college, but I did go to school long enough to learn how to read, so I can read the data for myself, and that's exactly what I've done.
Representative Clemens, you are
And
recognized.
for what purpose do you conduct your research and use this brain of yours?
Mr. Walsh, you are recognized.
I use it for the purpose of trying to protect children from being castrated and mutilated. That's one of the things I try to do.
You don't use it to.
Clemens.
Thank you, Mr. Chairman. You don't use it to get clicks on your
Let's state that.
publication.
Well, are you using it right now to try to get clicks with this interaction?
On.
No, I really like the
Mr.
idea
Walsh.
of getting of drawing attention to the fact that this is happening to children. I know you seem to find it very amusing. I don't.
Representative Clemens.
Well, you made a lot of misrepresentations and characterizations in your comments, so I think it's fair for me to question your background.
What did I
And your
mischaracterize?
let me finish, please.
You are recognized, Representative Clemens.
You know, if you're going to come before a committee and make mischaracterizations and misrepresentations, it's fair game for us to ask you your educational background and your foundational knowledge for making such characterizations. That's my point. So I'm curious about you speaking to the development of the human brain by the age of 25. I seem to recall you advocating on behalf of firearm possession at the age of 18. Do you think that's appropriate?
Let's stay on the bill, please.
That's all I got.
Okay.
Yeah, well, can I respond to that?
Representative Mitchell, you are recognized.
I can't respond to what.
Representative Mitchell is recognized.
Thank you, Mr. Chairman. So, I think your original article, blog post, or tweet, or whatever, kind of started this firestorm. So I'm trying to figure out, where we need to look for these surgeries, because I'm still trying to find, the surgeries, because, the sponsor of the bill last week, I kind of agreed with him. I said, we need to split this bill into two parts. I may agree with him on the surgery part, because I don't think it's happening. So, you seem to have started this, so I need your evidence of where these surgeries are occurring in Tennessee. Could you give me, places, times, maybe some names, or something that,
Yeah.
you know of?
Mr. Walsh, you're recognized.
My evidence is the healthcare provider's own words. I outlined Vanderbilt Health and their transgender care program, and the people that work for that program, their own words, talking about what they do, and talking about, for example, providing the chemical castration drugs to adolescent children. As far as surgeries, double mastectomies do happen, and the way that I know that they happen is that after I called attention to this program at Vanderbilt, they said that they were going to stop performing, they were going to put a pause on the program that performs these surgeries on minors. And so if you're pausing the program that performs surgeries on minors, then I'm going to assume that the program existed. Otherwise, you couldn't have paused it. So now, The exact number of kids who are being subjected to this, I don't know exactly. It's really hard to come up with those numbers, I think, because the people doing it aren't really proud of it, and there's not a lot of interest on their end to tell us. But I do think that, even one child being horrifically mutilated is too many. So I know that it's more than one, and that's reason enough to put a stop to this, I would say.
Representative Mitchell, you recognize?
Yeah. So last week I had an amendment that, we're looking to protect children from abuse. And I also had an amendment to stop cosmetic surgery of rhinoplasty and breast enhancements to minors. How would you feel about that?
Sure.
Is that mutilation of children as well under the age of 18? They can't think for themselves?
Representative Mitchell, that's not on the bill that we have.
Yeah, it is. It's surgical. It's surgical.
I'm happy to answer that.
You're free to answer, Mr. Walsh.
Okay. My personal feeling about banning breast enhancements for minors? Yes, I would be all for. Personally, I'd be all for banning that. Absolutely. Yeah.
Representative Mitchell.
Okay, and so I think the previous representative, proved that you have no medical background, correct?
No.
So you're here probably just as a public policy. You're trying to address good public policy, correct?
Mr. Walsh.
Yes.
So I just have to question, some of your public policy, expertise when, I'm reading here, Singapore is able to have nice things in part because they execute drug dealers by hanging and arrest even petty vandals and thieves and beat them with a cane until they bleed. We don't have nice things here because we aren't willing to do what is required to maintain them. So, with statements like that, I kind of have to question your public policy beliefs. And, and you also stated there'd been no studies. Well, I'm sitting here holding a study from the American Academy of Pediatrics from the University of Pittsburgh about the suicidal disparities between transgender and cisgender adults and children. So I think, before you state things, you may need to know all the facts. Thank you.
All right, thank you.
Can I respond?
Chairman Williams, you're recognized.
Thank you, Mr. Chairman. I make a motion to go back out of session, or back into session. Thank you.
Is there objection? Okay.
Walsh argued that long-term data does not support the idea that puberty blockers, hormones, or surgical interventions reduce suicide risk. He claimed there are no credible long-term studies and accused organizations supporting gender-affirming care of failing to prove the link in their own research. Walsh also criticized the rise in transgender identification among young people, calling it a social contagion, and alleged that affirmation may increase not decrease mental health struggles. He said rates of suicidality remain high even after gender-affirming surgeries. The questioning quickly escalated. One representative confronted Walsh with past comments made years earlier suggesting 16-year-olds were mature enough for marriage. Walsh rejected the characterization, calling it a hit piece, and arguing that even 18-year-olds may be too young for irreversible medical procedures. Another lawmaker pressed Walsh on his qualifications, asking about his educational background and medical experience. Walsh responded that he relies on common sense, reading available data, and his concern for protecting children. Tensions rose again when a representative accused Walsh of misrepresentations. Walsh attempted to respond, but questioning moved on. The next lawmaker challenged Walsh to provide concrete evidence that gender-affirming surgeries were being performed on minors in Tennessee. Walsh cited statements from Vanderbilt University Medical Center's transgender health program and said the institution paused certain procedures after public scrutiny, which he argued was proof the surgeries had been occurring. The committee then explored whether other cosmetic procedures for minors, such as breast enhancements, should also be banned. Walsh said he personally supports banning those procedures as well. In closing, one representative questioned Walsh's broader policy views and highlighted a study from the American Academy of Pediatrics referencing disparities in suicidality between transgender and cisgender youth, countering Walsh's earlier claims. The session ended with the chair moving the committee back into formal session after a contentious and emotionally charged hearing.